the beginning of May, we saw soon thereafter 4 different outbreaks in South County with people trying to get together. So although we've relaxed restrictions on a number of businesses, it's still critically important that you wear a face covering when you're out in public, that you keep a safe social distance of 6 feet, and that you wash your hands and not touch your face as much as you can. We are not clear of COVID, and even though our numbers are good, we know that as we relax restrictions, it's more likely that we will see more people contracting the virus. We have greatly increased our testing, and there's also a new website. If you go to the county's website at santacruzhealth.org/coronavirus, you'll find a link to the Save Santa Cruz County website, which has lots of information about our roadmap through COVID, information about the state's resiliency roadmap, as well as information about the 12 different testing sites that are available here in Santa Cruz County. The county is running the largest site down at Ramsey Park in Watsonville. You do not need to have symptoms to get tested there. Through the website, we'll provide information for you to schedule an appointment, and it's a drive-through testing site, and you can be done within 15 minutes. We are conducting lots more tests these days, and our goal is to do many, many more tests as we ramp up the capabilities of our partners at the university, at our local hospitals, and medical clinics. The last thing I'll say is I've asked our staff to come up with a simple process for local businesses to more easily use their outdoor space for dining. And I'm working with Soquel businesses at our county parking lots to place outdoor dining there, and working with Pleasure Point businesses about some creative strategies we have. We'll be approving some simple permitting process at our next board meeting on June 2nd. Tonight, we're going to be talking about the proposal in Soquel. We have a new system in which you can ask questions. If you look at the bottom of your screen, there's a Q&A button. If you click on that, a box will appear and you can write a question, and we'll be able to see it. We will work to combine questions together or group questions together. So if there's a question for Sheriff Hart, he can answer a number of questions, or program manager answer a number of questions. If you like a question a lot, there's a feature that you can hit a thumbs up, and that will elevate it, and that tells us that lots of people want to answer that question. I'll try to remind you throughout the evening, but I hope you'll use this feature to be able to ask questions. So tonight we have a lot of people on this call because since I last talked with you about this project, at the suggestion of folks in Soquel, we created a community advisory group. We received 29 applications, and I worked with my staff to identify 7 individuals who represented different parts of Soquel, had different backgrounds, whether it be in business, whether it be in fire safety or public safety, social work, and try to have some gender diversity to try to represent the various needs. They did not all know each other, but they have worked very hard to work together to find a single voice as much as possible for Soquel. I want to introduce Dave Pollack, who's a member of the Community Advisory Group. He's going to introduce the members of the advisory group and say a little bit about that. And welcome, Dave. It's really great to see you here this evening. And as soon as I turn on your speaker, oh, you're unmuted. So good evening, Dave. Great to see you.
Thanks. Thank you for the welcome. Nice to see you too. First, I wanted to just take a moment to kind of introduce everybody on the call to who these folks are that are on this community advisory group. So bear with me real fast as I kind of go through some backgrounds that everybody provided. So first we have Michael Moss. He's currently a fire captain for the San Jose Fire Department. He and his wife are both lifelong residents of Soquel and grew up in the Hilltop neighborhood. They currently live there now and raise their 3 young boys. Rich Everett and his family have lived in the area and operate Everett Family Farm and Soquel Cider. a local cider organic farm and farm stand across the street from the Seventh Day Adventist campground. They not only specialize, sorry, I'm getting a little visitor. They not only specialize in growing produce, but in growing young farmers to someday go out on their own to operate their own farms. They've lived in Soquel for 28 years. Craig Wilson, he's lived in the area for 35 years and in Soquel for the last 16. At the beginning of this year, he retired as the undersheriff with the Santa Cruz Sheriff's Office after a 33-year career in law enforcement. Paulina Borsic was the Santa Cruz Stop the Spread coordinator from 2007 through 2010. Formerly on the masthead of Wired magazine, she is also the author of Cyber Selfish and was an artist in residence at Stanford as part of her project, My Life as a Ghost. She is currently the caretaker of the family home built in 1975, which directly overlooks the Seventh Day Adventist campground. The family has always considered Seventh Day Adventists to be the best of their neighbors. Nora Hockman, who's lived in Soquel for 30 years. She's a retired union representative who adopted her daughter out of homelessness. Steve Goodson is a retired structural engineer with varied experience from design consulting and construction management in projects in places such as Saudi Arabia, Australia, and throughout the US, to construction dispute mediation, to facilities management for Stanford University Hospital and Medical Center, and finally public service as the engineering manager for the San Mateo's Department of Public Works. His parents built the first house on the small road off of North Rodeo Gulch, which terminates in the woods at the Seventh Day Adventist property. He's been enjoying the Seventh Day Adventist Conference every July for the last 48 years and looks forward to a successful resolution on this important issue regarding the homeless population. And last, me. I currently work in the tech industry. I'm the president of the Mountain Parent Club for the Mountain Elementary School District. I'm a member of the Capitola's Soquel Little League Executive Board. I spent the past several years coaching baseball, Little League, and soccer through Cap Soquel or Mid-County. Prior to that, I spent 16 years in law enforcement with the city of Santa Cruz, and I previously taught high school regional occupational programs through Santa Cruz High and Harbor High School. That is your community group. Now that you know who we are, I wanted to take just a couple more minutes to let everybody on the call know what we've actually been doing. So since we first met less than a week ago, we've had several meetings to organize ourselves to operate both efficiently and seamlessly. We've met with John Leopold, the county, and the Encompass teams, and some additional stakeholders in some of those meetings to address questions, concerns, and recommendations that we've had along the way. We are optimistic with the progress we've made in this short amount of time and anticipate even more progress in the near future. Right now, we have focused our efforts on three primary pillars of concern. The first is dates and timelines, the second, fire safety, and the third, criminal activity. While we understand that there are many more concerns, we do need to start somewhere. We continue to work through pages of questions with the program stakeholders. We plan on closely monitoring the first phase and have been guaranteed that there will be no future programs, expansions, or phases at this site regarding the homeless without public input and approval. We wanted to express our gratitude to the community for their direct feedback, questions, and passion. We also want to thank John, the county, and the Encompass teams for their commitments they have made and their continued efforts to obtain the information we've asked for. Your input and support has been phenomenal as we continue to work with John Leopold, the county, and Encompass teams toward mutually acceptable goals. Tonight, the stage is set for John and team. We'll be here on the call to hear your concerns and allow for John, the county, and Encompass teams to answer. Thank you.
Thank you, Dave, and I really appreciate the effort. He was very modest in the amount of time that the Community Advisory Group has put in. Over the Memorial Day weekend, while you might have been enjoying the beautiful weather, they spent hours getting to know each other, identifying issues, and preparing for our advisory group meeting yesterday, where they came with over 45 questions. And we began unpacking those questions. They were very thoughtful and important, and we didn't get to them all, but we were meeting again on Monday to continue that conversation. And we also delayed the move-in date of the trailers to ensure that we could answer as many of the questions as possible before that happens. And that was at the request of the Community Advisory Group. Joining the call also tonight, we have a number of people from Encompass Community Services, who has been doing our outreach to the transition age youth and is one of the largest landowners for residential housing for different groups of people in Santa Cruz County. And tonight we will hear from Christine Sipple, Meg Clark, and Shebra, trying to remember Shebra's last name because it's slightly difficult.
Kalantari Johnson. Shebra's muted.
Shebra Kalantari Johnson. So sorry about that, Shebra. And also joining us is Fire Chief of Central Fire District, Stephen Hall. Chief Hall has been involved with lots of these discussions. I appreciate the time he's committed to this. Also joining us is Sheriff Jim Hart, who's been active and involved in the review of these plans, and Elissa Benson, who's the Assistant County Administrative Officer for the County of Santa Cruz. Elissa is handling all of our standing up shelters for the homeless and during this COVID crisis, and I appreciate the work that's gone on. Just to be clear about what we're going to be talking about here tonight is very different from what was originally sent out on May 1st, and what was also different from some of the conversation that had been circulating via Nextdoor, Facebook, and other places. We're looking at a very limited and temporary program for currently will be 10 trailers with the ability to go up to 15 trailers, although we'd have to find out where we get the other 5 trailers because the state it's unclear whether the state's going to be providing any more trailers. But no more than 30 people on the site, that there's going to be 24-hour security on the site, as well as at least 2 staff members. We've gotten a lot of questions about a second phase, which we originally envisioned, and in the original proposal would include a lot of people. Once we actually started doing the work with program providers, it became a much smaller idea. And as Dave mentioned in his comments, we will not be moving forward with that part of the program, even for 20 people, without consultation and approval from the Community Advisory Group. The last thing I'll just say is people often ask that this is a remote site, and so wouldn't it be better to have folks at a place that was more accessible? And I understand that. Getting these trailers from the state, brand new trailers, means that we had to find a place to put them that had access to services. We did check with the state parks, but we were refused for putting the trailers at that location. There has been talk about a site that was used after the '89 earthquake. While the pads are there are no longer active electricity, water, or sewer service. So the investment would have been extraordinary and we were trying to move this through quickly to be able to meet the needs. The Seventh Day Adventists decided in March not to hold their annual camp meeting, which they've held for the last 73 years, and offered their site to be of use for the county. And after some discussion, this proposal was drafted, and right now we only have an agreement for this program involving the trailers of no more than 30 people. So we want to talk about that tonight. We've put a lot of time into thinking about it. We're not done talking about it tonight, but we want to hear your questions and concern. I forgot to mention that Todd Gallimore, who's a representative of the Seventh Day Adventists, has been living on that site for many years, is also joining us. And I want to remind people that if you want to ask a question, you can use the Q&A function and write it there. And for those that are that you want to ask that same question, you can put a thumbs up next to it, and that elevates it. It tells us that's the question that people want to answer. If you have a question that wants to be asked of a certain member of the group, you can put that in there, and then we'll work to answer them. I'm hoping we can get this meeting done in an hour to an hour and a half using this system, and we'll work our best to try to answer as many, if not all, the questions that are there. So the first question is for Elissa Benson. It says, in 2018, when Santa Cruz opened the River Street Homeless Camp, and again in late 2019, when Santa Cruz opened the Ross Homeless Camp, alcohol and illegal drugs were specifically prohibited. A large number of TAY are underage for alcohol use. Why is the county making an exception to permit alcohol in the campers in the specific homeless camp? Before you answer, I just want to make one factual change. Santa Cruz did not open the homeless camp. People started congregating there, and then it took them 3 months to figure out how they would close that camp. We offered help about a few weeks into it, and it took a while for that council to figure it out. But Elissa, do you want to talk about this question about alcohol?
Sure, happy to answer that question. As we've discussed this is a particular kind of emergency response. This is a shelter-in-place emergency housing program. I wouldn't really call it a camp. We will be utilizing trailers from the state. With regard to alcohol, in many non-COVID related shelters, it is local policy, where policy meaning the provider does generally restrict, I would say, legal substances, alcohol, tobacco, marijuana, either restricts the use entirely or designates it for specific areas. In this particular instance, because this is a shelter-in-place program, around alcohol, our working policy is that our clients who are 21 and older can use alcohol within the trailers, and that's specified in the agreement. That's the only place that they would be able to. Our thinking behind that is we do not want to, we want to keep people on the site. We don't want to create a reason for young people to leave the site and go and drink somewhere else, in a park, so, out in the community. So that's our basis for allowing it as part of the shelter in place. We're not promoting alcohol, but more importantly, we're trying to promote that these young people stay at the location where there is supervision, there is support, there is staff. That's the motivation and the thinking behind that component of this program.
And just for clarity's sake, will anyone who's under 21 be allowed to drink?
No.
Okay, thank you. So we've gotten a number of questions or support for a question about what is our exit strategy when the camp will shut down and what will happen to the residents at that time. Just so people are clear, again, before someone takes this question, this is a temporary program to be used while the shelter in place is enforced. We don't know how long that shelter in place order will be enforced by the state of California. If you'd asked me a couple of months ago or even a couple of weeks ago, I would say that it was clear that it wasn't going to end before 2021. The governor in the last couple of weeks has moved pretty quickly, and so we don't know exactly when that will happen. But we are trying to work to prevent the spread of COVID among the community of people experiencing homelessness. So, Elissa, do you want to talk about what the exit strategy is for this and what will happen? Maybe Christine or Meg can talk about what will happen with the folks.
Absolutely. So, the exit strategy in terms of the trailers, and I'll really leave it to our program team around how do we support the young people in this program throughout and towards the ending of the program. The exit strategy for the trailers is we will be starting as next week, looking at where we will be able to relocate these trailers post shelter in place, hopefully with the intention of integrating them into our countywide homelessness response program. The challenge, as John indicated, was finding a location in the first place that has sufficient infrastructure for these trailers. So it's going to be an interesting task ahead, but we absolutely want to be able to take these 10 trailers and integrate them into our sheltering program. I think people are quite aware that we have a very large percentage of unsheltered homeless people within our county. About 80% of our homeless folks here do not have access to shelter. So our intention would be to remove them from the property as quickly as we can when the shelter in place is lifted, and be able to integrate them into our program widely, whether that's in a set location and we need to build the infrastructure to support it, or we're able to disperse it through a different approach. That's the stuff we'll be starting to look at. So that plan is in place as we move towards the lifting of a shelter in place. So we would remove them from the property as quickly as possible and get them back into use to support people who are experiencing homelessness. And now really, probably people are worried about the young people who are there and where are they going to go. And that's something I think Meg and Christine can answer if this is the appropriate time, Supervisor Leopold.
Yeah.
Yeah, thanks for covering that first part, Elissa. So the actual moving folks out of the space, we have a 2-week plan for how we would help to transition anybody that's left on the site, moving out into different programs. We're super connected in the community, and we work with these young folks on a regular basis, and our goal for all of them is to get them permanently housed. So from the moment that they've been connected with our program and staying at Simpkins to when we move into the shelters, that whole time we're trying to figure out how do we help to stabilize them so they can get on with life in a normal way and continue to build their future. So we work with programs throughout the whole county. We have probably, I don't know, I can't even tell you how many connections to different programs we have. Just today, I heard of potentially somebody else getting hosted in some of the host homes that we're connected to. So our goal really, while we're there, is to get as many folks housed and stable as possible. So that when the time comes that shelter in place is over, that we have as little people that need to find a program that they can stay in.
Thanks. So there's a lot of suspicions about was this being planned before COVID and we're just using the COVID crisis. I get a lot of questions about this because in 2018, the Association of Faith Communities approached the county about doing a safe spaces parking program. When they met with me and the county staff, I said I had a lot of questions about this. How would it work? What would be the safety and security? It's a remote place. What would happen in the morning when they had to leave? What kind of staffing? What kind of budget? I will admit that there's a lot of things I don't know, and so when I asked those questions, I said you need to prove that you could actually pull this off. I don't see how it could be done, but I'm open to a plan. They went away, and 5 months later, they decided to start contacting neighbors to say that they wanted to do this program. As soon as we heard about that, we canceled any conversation, and we have not talked to the Association of Faith Communities about a safe spaces parking program at the Seventh Day Adventists since that time. I am not aware of any planning to use this site for anything other than emergencies. I think it is in the EOC plan as a potential site in the event of an earthquake or fire or something like that, where it's listed somewhere in some documents, but there was no plan to house the homeless or trailers by the county there beforehand. This came up when I was approached by the Central California Coast president of the Seventh Day Adventists, saying the site was available. At that time, we were looking at this pandemic in a very different prism about the scale of the work that we needed to do, and I took the offer to county staff. It took them a couple of weeks to get out there and do a site visit, and from there develop a plan. And as soon as it was out, I sent a letter to neighbors. So there's nothing else to it other than that, and I don't think you'll find anything other than that. There's also a question about that it seems like this is a very short payoff, that isn't the shelter in place over July 1st, and so why are we doing all this work and going through all this grief and causing all this anger before then? I just want to be clear that the new shelter-in-place order now has an end date of July 1st. We do not expect that the shelter-in-place will be over on July 1st. That is when we might expect to see more changes to our shelter-in-place order. The shelter-in-place is although the county moved into that before the state of California, 3 days after we did it, the state of California instituted their own shelter-in-place. So we are covered by that shelter-in-place order. We're allowed to be more restrictive here in Santa Cruz, but not less restrictive. So we don't know when that shelter-in-place order will be over. I can tell you that, as I mentioned earlier, that just a couple weeks ago, we would assume that it was going to be going into 2021. We don't know what the end date will be. It's highly unlikely that it will be July 1st when we can go back to everything that we did back in January. And so we don't know what the end date is for this, but I've made a commitment to the community advisory group, and I will make the same commitment to everyone listening tonight, that this program will only be in place while there's a shelter-in-place order, that this is not a permanent program, that we're not going to turn this into a permanent program, and that the county staff, once they move everybody into this site, they've already started work, but they will begin in earnest to start looking for a site where these can go long-term to fit into our homeless strategy. We're moving into this site because it was ready to go, and that was an important part. There are also some questions about land use, about what's the legal authority, and I did post on my Facebook page the memo from the county planning department that talks that this is not a misuse of their zoning permit. There's also been the appropriate paperwork filed on this. We allow many more RVs at this site than is being used in this program. And so I feel confident that we're on firm legal ground, that we aren't violating the permit, and that we're not proposing any long-term strategy that would be different from the permit uses that are currently there. And I don't support, especially outside the urban services line, the intensification of the use. The question is asked, why is this site with no public transit, sidewalks, access to services, an extreme fire danger, residential agriculture zone, the best possible location for where these are to go for these 10 trailers? Elissa, I've explained it once, but do you want to take another shot at that?
Happy to. As we've noted, this is a trailer-based program, so we need to have the infrastructure to support the trailers for providing a shelter-in-place resource for these young people. And one of the benefits of the trailers versus where they are right now in the Simpkins Community Center is that's a tent-based model where there's a lot more interaction and between the various sort of groupings of young people that are engaged in the program. So for us, the key thing we had to look for was a place that could actually host these trailers that we had donated to the county by the state. So that's really sort of what is driving this locational choice, and the readiness of infrastructure, given the importance of containing spread and providing an opportunity for people to shelter in place. We do recognize the limitations of the site in terms of public access to public transit, and the team has developed a shuttle program. So our participants will not be walking on and off the site, will not be biking on and off the site. They will always be escorted off the site if they don't have vehicles of their own to get access to transit. So that's why we've approached this particular site, recognizing it does have limitations given exactly where it is located in the community.
Thanks. There was a question about security at the site, and I wonder if Sheriff Hart, you could weigh in about security, safety, and the plans for the site and how you're going to be looking at it.
Yeah, thank you, John, and good evening, everybody. So there's going to be 24-hour security on site along with the people that work there. And I've been asked in a previous meeting whether it was possible to put a full-time deputy around the clock there. And we just don't have that many deputies and those kind of resources to do that. I do think that having a security officer who will really be the eyes and the ears of the community and for local law enforcement to be on site and report any illegal activity or something's going on will be very beneficial. I also have been hearing that there's rumors in the community that we're going to be using this facility as an extension of our county jail system, since we released some inmates in order to create some space in our jail system. And I want to assure everybody that that's not the case, that there's nobody, none of these young people were released to jail to serve their time at the Seventh Day Adventist camp. The people that we released were all getting towards the end of their sentences and were released with their credits of time served. I have looked at the security plan. I think it's a good plan. I think it's going to work. And if there is a problem, we do have a lot of increased staffing with our deputies in the area. We usually only have one deputy in Soquel, and we're working 24 hours a day with 2 deputies in Soquel. And so we'll be able to respond quickly and efficiently to the location if the need arises.
And could you say a little bit about the kind of information you're putting together for the community advisory group, the analysis, the data, and that you're going to be sharing with the group?
Yeah, and I think I mentioned last night that it's quite a bit of data, so we couldn't turn it around in 24 hours. So that's why I don't have it for the group tonight. But we've been asked by the committee to come up with information about calls for service in the Simpkins swim area where they're at now, or the Simpkins area where they're at now, and what kind of calls for service, dates and times of those calls, how are they cleared, and there was some other questions about whether these people were going to be on work release or ankle monitors. So we'll provide that information as soon as we get it. And I think I told the group last night we'll get it back to them in about a week.
Okay, thank you. There was also one more question about, and you may have, I think you covered it, but how many people will you have staff to maintain adherence to the rules? There's 30 young people here. The questioner is concerned that they might be not obedient. Are we appropriately staffed for something like this?
I believe we are. We typically, our minimum staffing levels for the entire county for all 450 square miles is typically 8 on day shift, 8 on swing shift, 7 on night shift. We've consolidated teams down to 7 in the morning till 7 at night, and 7 at night till 7 in the morning. And so now, instead of having 8 on duty during day, we typically have between 14 and 16 deputies on duty during the day. And then, as you are all aware, CHP patrols that roadway for traffic. And so I believe we have plenty of law enforcement out on the street should the need arise.
There's concern that the cell coverage there is not great. And so do you have any concerns about people being able to reach the sheriff's office if something arises?
If they're calling at around the Seventh Day Adventist camp, we can. I think the cell coverage is good enough. We're going to get the information that we need, and the first alarm or whatever security company is used will have radio capabilities to their dispatch center, that can then contact our dispatch center. So I don't think communications are going to be a significant issue for this camp or the situation.
Yeah, another question comes in that was directed to me or the sheriff, but and I'm happy to add to it, but this might be a question for Meg or Christine about if one of the folks who are there, these young people, want to leave, and staff doesn't want them to leave, but they push themselves to leave. What happens at that point? Christine or Meg?
So I'm trying to understand the question a little bit better. So if somebody were on site that we felt shouldn't leave for some reason, if if they weren't in a good place to leave, we would be driving them, or we would be contacting somebody to help us transport the young person if we needed to ask them to leave. If we didn't want them to leave, uh, we're a program where folks are they're young adults, so there is a level of autonomy that happens there. And so if somebody wanted to exit the program, they would of course be at choice to do that, and we would support them in figuring out which programs we could refer them to, how to get them connected, and wish them well in figuring out their next steps. Our encouragement, of course, is to stay. This is our shelter in place spot. This is a safe place. It's a place where we're trying to contain the spread of COVID. And so we would definitely be encouraging them and having conversations about that. And we would want to make sure that they were supported in getting to another location where they could safely shelter in place if they were going to leave our location.
I think, I'm not sure, maybe the question is about, people are not allowed to walk off the site. And what will we do if somebody breaks that rule or that community expectation? And, we have two kinds of infractions or behavioral issues that we'll address by immediately exiting individuals. And that relates to anything related to fire risk and rules we've set in place for that. And the other is any kind of violence. So we would, people will need to leave, and we'll, if we need to call law enforcement and assist with that exiting, we'll do that. We do that in our regular programs. But if somebody, breaks the rule and walks off, we would use, that would be the kind of problem that we would use a progressive discipline approach, a stepwise approach. So when somebody breaks that kind of rule, they get a verbal warning, and then they develop a contract agreement. If they break that contract, then they lose their chance, and then they're exited. So there are a number of kinds of rules that's the response to, and this would be one of those, I believe.
Great. There's a number of questions about this site. Were other sites looked at? Could we have considered someplace else? The Toys R Us building is brought up. The wouldn't these be better on a parking lot in a more urban area? Elissa, do you want to answer that question again?
Sure. So we did look at different parking lot scenarios, and one of the original ideas we had was partnering with Cabrillo College, since we have a number of our young people who are students there. And really the cost and development of the infrastructure to support the functionality of the trailers made it prohibitive. So, I mean, I think there's been the idea that we could have standalone showers, standalone shower trailers, and standalone sanitation trailers. That is true, but that still is going more towards a congregate model, and we're trying to really move towards as much separate spaces and less congregate interaction between the clients. So having the trailers be functional was one of our goals, so that they actually would be able to utilize the bathrooms, the showers, the small kitchenettes within the trailers. So that's why we moved away from a parking lot based approach, because we really wouldn't be able to utilize the functionality of these donated trailers. And it was quite expensive if you tried to do something to sort of bring it on site mobily. And we would much rather use a site that has activity or has the infrastructure that is centrally located, and that we can support folks, our young people who are in particular essential workers, that they are able to more readily get to their jobs in different parts of the county.
And could you just answer why they're not staying at the temporary shelter that we've set up at Simpkins?
Sure. There's been a lot of moving parts to our emergency response to COVID. And initially, when we decided to put them there, because we did not have, one, we didn't have the trailers yet, and we did not have a location secured, we decided to open up the Transition Age Youth Shelter-in-Place program at Simpkins, because we knew we were going to be getting the trailers, and we were, confident we would get a space. So we decided temporarily to put it there, with the understanding at the time when we opened it on April 17th that we would have to be ready to leave in the event that site would be needed as an alternate care site as part of our overall health response. So that was one of the reasons why we started it there. We knew the trailers, we'd been told the trailers were coming, we didn't know when, and we knew we needed to get something in place quickly. So that's why we started at Simpkins. But we also at that point thought there was a reasonable chance we would be asked to leave. Subsequent to that, the whole shift around alternate care occurred, and the state moved towards less localized models, and our anticipated surge was pushed out given our pretty overwhelmingly successful ability to flatten the curve here in our community. We then had the idea, we got the trailers, we had started these conversations with the Seventh Day Adventists about accessing that location, and started moving forward with the idea of moving into that mode. Now, the use of the Simpkins site is going to be part of a summer childcare program for essential workers. So we can't leave a 24/7 shelter-in-place program at the site at the same time that we're going to be starting this essential worker summer camp childcare program. So, and we want to be able to use the trailers and move to a more, what is more recommended is going to more individualized housing units as opposed to congregate setting, consistent with direction from our public health officer and from the Center for Disease Control. So that's sort of why we're not staying at Simpkins. I will say, yes, the reason changed over time. Originally, we were told don't expect to be here long term because of alternative care. And we wanted to move forward to use the trailers. And then this secondary use, now that we were leaving, was how can we use this site, the Simpkins site, to best address needs of the community. And the summer essential worker childcare program was advanced.
Yeah, I just want to stress that while it appears as though the county has changed positions, the circumstances have changed. What we knew in March, April, and even May has changed as we get closer here to June. As an example, 2 weeks ago, the governor outlined a strict set of measures that had to be met to get into the second part of stage 2 of his 4-stage resiliency roadmap. It required very strict testing requirements, tracing requirements, hospital requirements. At the time, our staff didn't think we could meet those goals for about 3 weeks. Then the following week, he relaxed those rules. And all of a sudden, we could meet the testing and tracing categories. And then we had to file an attestation. We began work on that, but we were also concerned by what we'd seen in terms of the cluster outbreaks in South County. Over the weekend, the county staff worked on putting together the paperwork, and then on Monday, the governor announced, without any awareness to county health staff anywhere in the state, that he was going to further loosen the rules around religious services and just put everybody into, for most businesses, into stage 2 that he considered a stage 2 business. And then the following day, he also included hair salons, which had previously been a stage 3 business. So the county is trying to keep up with the epidemiology of the disease here in Santa Cruz, trying to keep up with the requirements of the state, and trying to keep up with the changing sands that the state has set for the stages as we move through. There are also a couple of questions here that came in about we're supposed to be keeping 6 feet apart, but we're putting people who are not a family in the traditional sense together in trailers. Meg, do you want to talk about what has already been happening and how you're looking at that as you move people into the trailers?
Yeah, absolutely. So young people, and especially that are experiencing homelessness, tend to form little affinity groups. We've been calling them pods. We've been calling them chosen families. They're the folks that are really in their circle that they're tight with. Some are sharing tents currently at Simpkins Center as a chosen family. And so they are already in each other's germ bubbles, biospheres. And so those are the folks that we will be putting together into trailers. The trailers originally could hold 6 to 8 people and are bigger trailers, and we are limiting how many folks are in those trailers to 2 or 3 max. Particularly for the long term, you know, the more than a week or so that folks will be in there, we think that'll be most comfortable, but also to really minimize how many folks are being exposed to each other's germ bubbles. So, and then each of the spaces are still separated as much as possible, but that's kind of how we've decided that this might be a good group that is already exposed to each other's germs to be in a space together.
Thanks. And this is the work that you're doing is in consultation with our health department. This isn't just something that Encompass came up with.
Right. I would just add that we haven't had the chance to mention that we do have, that first of all, that our largest group of people who will transition to the trailer site have already been residing as shelter guests at Simpkins. So they're known to us. They're making plans. We know their backgrounds. We know their behaviors. And as Meg mentioned, some are couples and came into the Simpkins site as couples, and some were friend groups. And then we also have families. We have one family, I think if I'm not mistaken right now, with some young children, which is not unusual for the population that we work with, that young people have young families. And so the trailers work well for that. And if you can think about it, the young people that weren't, like we're in university in our community and weren't able to go home to shelter in place at their families and residence, some of those have remained in apartment style living in small groups and are sheltering in place. And that's essentially what we're creating an opportunity to have for these young people. And also to emphasize that the real point of this is to make sure that this population within our community of people who are experiencing homelessness are not out kind of sleeping in their cars, roaming around to different places, intermixing with different people, not reinforced on sheltering in place, not learning and understanding what's going on with the virus, that we've brought them in, which is our goal. We knock on wood, we have been really fortunate not to have any homeless transmission in our community, and part of it is because we've done this job of bringing people in and setting up these shelter-in-place environments that are safe and that we're paying close attention to. So that's what we're really creating, this, very small, either couples or kind of small apartment living, sheltering in place with people knowing what they're doing, and we're able to observe them and encourage them and reinforce them, have them understand, for those who aren't working. Many are working and going and either working at essential businesses in the community or accessing essential services and businesses. And for the others that, they can even understand and learn. They're not out of communication. They can learn about what are essential services and what is opening and what should be expected and what are the mask wearing, rules in our community. It's a way to make sure this population isn't just out there and preventing that there's risk happening. So that's what it's really about. I had to say that.
Thanks for explaining that. there's a number of people who believe that there's an alternative story to this. We're paying the Seventh Day Adventists some money for use of their spots. Elissa, maybe you remember the exact number and could share that with folks.
Sure. So in the emergency use agreement, there is consideration for allowing us to be on site. And that boils down to $20 per day per trailer. And that covers basically all our access to the entire, well, I shouldn't say the entire, the property that we have been granted access to. The parking for the trailers, parking for staff cars and any cars of the clients, access to the cafeteria, waiting room, or I'm sorry, dining room. So we do have a large space for some group meetings with appropriate social distancing. The laundry there, and it also then pays for all the associated utility costs, water, electric, septic, internet. So that's, we're paying, what that equates to on a 30-day monthly basis is $600 per trailer. And that's the consideration that we are paying to SDA for use of the site, and basically our compensation for their payment, their provision of utilities.
Great. And Todd, is this seen as a major moneymaker for the Seventh Day Adventist?
No, it's not. We typically charge our members $40 a night with their RV, and they're the ones that help support, the campground. So we're not looking to make money. If we can cover some costs, pretty much that's all we're, looking to do.
Okay, thank you. So there's concern, Sheriff Hart, that in budget cuts that there will be less deputies, and what would happen to the coverage in Soquel if there are problems at this site?
So I talked about our staffing that we have, and that will continue during this emergency until we get into phase 4 and everything opens up. In addition to those 14 to 16 deputies that are on duty, we also have 7 deputies on the beaches and a couple supervisors. So there's another between 7 and 9 law enforcement officers from the sheriff's office patrolling the beaches from the North Coast down to Pajaro. The budget cuts are an unknown at this time. We're preparing for some cuts. I'm not going to be cutting deputy sheriffs. There's some other ways of achieving those cuts. So the staff that I have today should be with us next year. And so I don't think the budget cuts are going to impact us. We are looking at some potential furloughs, and we'll have to deal with that. But it shouldn't significantly reduce the amount of deputies that we have on the street. Each deputy is going to have to do roughly 100 hours of furlough time a year. And so we can space that out over 12 months and get that done and still have very good coverage in our patrol division.
Thanks for answering that question. There was a fire question for Chief Hall. About there's a lot of space on the lower portion of this property. Wouldn't it be wise to keep everybody down there and not allow them up into the trees? I know we talked about this at the Community Advisory Group. Do you want to share your thoughts on that?
Thank you, John. Good evening, everyone. I do believe that utilizing the lower 50 acres for the clients is a wise decision. And I think consensus was gained amongst the committee at the last meeting. I do agree that if they are scheduled and chaperoned walks up for counseling or having a conversation with a group of the clients, that would be acceptable with the rules understood. Although our Community Risk Reduction Bureau, our fire marshal, and our fire inspectors are going to provide training and education to staff and clients in regards to fire and life safety, by not allowing smoking per se on these walks as they're going up and having these sessions is a crucial element to ensuring that the fire safety and fire and life safety are taken care of. So I would recommend utilizing the lower acreage and keeping, for the most part, everyone out of the upper areas.
Thank you. There's a question, and it was a question that we didn't get to at our community advisory group. I won't be able to answer it in great detail because I'm neither a lawyer nor a risk manager, about the amount of insurance coverage we have, the county has and requires for this. And so the county has excess liability insurance policy for an amount above $1 million. We don't usually cover things that aren't on the properties in which we're acting or conducting business. But we are very used to being sued. That's a common occurrence. That's why the county has 12 different attorneys, and why we have an entire risk management office that reviews things to try to avoid us from being successfly sued. It doesn't mean that they're always right, and it doesn't mean that we don't make payouts. In putting together this program, we are working with Central Fire. They're going to be up on the property before everybody moves in, and once everybody moves in, they're going to be doing training for both staff and program participants. And we are working with the community advisory group on a reasonable set of guidelines to ensure that there is low fire risk for everyone involved, and you can't prevent everything from happening, but you also can't get insurance for everything happening. I'm confident that the county has taken a good effort and that has created a program that is low fire risk, and that we have enough insurance to be able to cover it should we be held responsible for it. There's also a question about what type of activities will residents be involved in during the day? Will they have a job? Do they have a job? Or go to school?
So I can speak a little to that, and then Christine might have something to add as well. So our folks are often engaged in working as essential service workers. They work at our grocery stores, at convenience stores. Some do childcare, and some were in school. With COVID and having access to technology, that's been challenging. And so the technology gap is something that we're helping folks to bridge so that they can continue their education. And then there are folks that are, during the day, we try to have activities going on. I would say that our young people are really tied in to the staff. We enjoy spending time with each other. And we know these young folks and they know us. We do poetry classes, we do distance yoga, we do all kinds of things to keep ourselves and them occupied so that sheltering in place can continue and be safe, and also continue to support their ongoing mental health. We also connect them to mental health services throughout the county if that's something they're interested in. And bridge connections to other services as they need it.
And Meg or Christine, the question's asked, why don't we just find a permanent place for these young people to live instead of this temporary spot?
Well, that's a challenging situation in our community, but it is something that each young person who's there, or couple or family, will be working on while they're there. Each person that will be there has completed an assessment to help develop a plan for what kinds of assistance for housing they would be eligible for and what steps they would need to take to move towards that. One of the advantages of this program for this group of young people is that there is a network of funded new projects that are focused on housing. And that includes 2 that provide 6 months to 12 months subsidy for rental housing, if we can help people to find rental housing that they can afford, and as they build their income or continue their education, they can use that. We have another program in the community that's fairly new that is struggling a bit during COVID, but as things loosen up, it's called Host Homes, and it's a program where young people can be sheltered or housed for a year or so with families that have an extra room in their home. People are hesitant to do that without understanding people's COVID status, but we're beginning to work on having that program open up. There's also a permanent supportive housing for young people that are discovering that they're going to be dealing with a long-term disability. That's often mental health disability that's showing itself right now. And we have a program that will house 6 people who are in that situation. So it's this is a really beneficial thing for us to have people, instead of roaming around at this time and being at greater risk, that they can access these services, and we can bring programs in. While they're there, each person will have a case manager and have the opportunity, while they're stable, to develop their goals and plan and get support to work on them.
Thank you. So the questioner is asking, do I know that the sewer and septic system has failed on this property? You know, is this something you're aware of and paying to repair? Todd will correct me if I'm wrong, but currently the systems are in operation. We are not paying for the repair of those systems. This is a much more modest use than what they see every year as part of their ongoing camp activities. And I believe in the not too distant past, they got a bigger water tank there. And while the sewer system may have failed, or the sanitation system may have failed in the past, we could go to a lot of houses where that's happening. But Todd, is everything currently working, and will this be able to support these 10 trailers?
Can you hear me?
Yeah.
Absolutely. Right. So we have septic tanks, and I guess we have some leach lines, but every year we spend a lot of money pumping the tanks out. And so everything's operational. The water system is fine. We're in the process of replacing our south water tank, but that's on hold for right now because we want to make sure that we have enough water, of course, in case there's an emergency and so forth. So everything's up to snuff and working. We've been going through some upgrades lately, as you had mentioned. And so very confident that everything's going to work. 30 people compared to, what we typically have for camp meeting is a walk in the park.
Great, thank you. So a questioner is asking that with all this stuff that's going on, and his belief that the shelter in place is going to end in 30 days, wouldn't this all be for nothing? And as I mentioned earlier, I do not believe that the shelter in place will be over in 30 days. I think we're going to be living with COVID for a while. And while we will reopen businesses, we are still not encouraging people to do anything more than essential travel, to go out and do their essential business. We haven't okayed people even gathering together. We are trying to discourage even families from getting together, because we've seen that that's been a cause of outbreaks. And so is it going to be 2 months or 6 months or a year? That I can't tell you. That would be a great crystal ball if I had that. What we're trying to do is answer the need that's here right now during this COVID crisis. And I'm confident that if we take the step necessary, we can continue to limit the spread here in Santa Cruz County. People in Santa Cruz have done a great job, and the efforts to prevent the spread of COVID with at-risk and vulnerable population, whether they be people experiencing homelessness, people in our jail system, people in our nursing homes, has been exemplary. It doesn't mean that we will never have a problem there, but we are working very hard to ensure that it doesn't become a big problem. and it doesn't overwhelm our medical system, because if that happens, that puts us all at risk. There's been a couple questions here about, there's a big hole in the fence near my property. The fences aren't in great shape. Will we be fixing fencing before these people move in? Todd, I don't know that level of detail, I don't know.
Well, it's a work in process. We're working on, especially in the North Park area, repairing the fencing, and hopefully we have plans down the line to replace the fencing in the Central City area, which is the central part of the campground, and all the way down. But little by little we'll get there. But as far as for the program, I think we'll be fine.
Great. So this has been asked a lot of times, a lot of concern about fire, and there is going to be a small smoking area that will be approved by the fire chief before it's in use. But what would be the penalty for smoking outside the designated area?
So that's one of two things that we're taking, and several things that we're taking very, very seriously. We've heard the community's fear around fire safety, and anyone smoking outside of that area will be immediately asked to leave the program. We're communicating that before we're moving. We're communicating that before they're working on their agreements for how they're going to live together. And that is being communicated very clearly to them, that this is a real concern in this community, and that it's as much as in our benefit to make sure that it's safe for us, for the young people, and for the community around us. So anyone that's smoking outside of that zone will be asked to leave.
Thanks. So there's been a number of questions about testing of temporary residents for COVID. Elissa, what are we doing around testing those folks in the homeless community, and what's our expectation about testing for folks who are part of this temporary community?
So first I'll just talk a little bit about testing broadly. I think as Supervisor mentioned, right now we have a testing site in Ramsey Park in Watsonville that is in collaboration with the state, where anyone in our community, and this is for folks who are not symptomatic, who are concerned about being asymptomatic with COVID, can go and get a test. So that's available broadly. If you're symptomatic, the recommendation, from our public health unit is you need to go to your, work through your primary care provider, and then if you would then be tested through the healthcare system. And part of this is the managing of tests is really, again, around if we have positives, whether you're symptomatic or asymptomatic, having that public health infectious disease response to help with contact tracing, to help people understand, how is this disease spreading in our community. Around congregate living situations right now, our public health unit is working on protocols for bringing testing to different congregate living sites, because you want to do that in a thoughtful way to make sure you have, again, the same resources around contact tracing and making sure people have the supports on sites to deal with if you have positive results from that. Right now, the recommendation is not to go proactively and test all congregate living sites. But as I mentioned, any of our clients, we can support getting them access to testing if they're concerned that they are asymptomatic and could have been exposed. If we have exposure, we have a separate system that we have set up as a function of our countywide response, which is our isolation quarantine shelters, this is where we've done master leasing with hotels, a number of hotels in Santa Cruz, and we're opening one in Watsonville. So if any of our homeless population who clearly don't have a place to isolate or quarantine, and they're positive, we would move them immediately out of the setting into another setting where there's health care on site, services on site for people who are sick, and you really try and control any exposure of people who are positive in that environment. So it's not right now recommended by our public health officer to test everyone going in. I think we may be going down that road probably in the next couple of months. But at this point, there's not a recommendation to do massive testing at a particular congregate site. And this is, as we've mentioned, a little bit fuzzy on the congregate. There's quite a bit of contact, even though we're doing social distancing at the Simpkins site. And these folks have, as I think what Meg called, a certain level of a shared germ bubble at this point. So we're trying to be conscientious about that and talk with public health about how do we manage it most safely.
So there's a,
if I could just add, John, I'm sorry.
Sure.
I just want to add, we forget to talk about it because it's like daily life at the Simpkins Center, but all of the shelter in place sites in the county are set up so that every time somebody leaves the site and then comes back, they get screened for symptoms and also temperature. I don't know if we'll continue to do temperature, but it's the way that we're able to reinforce with everybody that that's why we're operating this shelter. And it also allows us to teach everybody what are the symptoms, for the suspicious symptoms for COVID, so that we always ask, are there any new symptoms? What are you experiencing? And should we discover that, then we have a whole protocol for isolating that person with those suspicious symptoms until they can get tested. And then if we have a positive case, again, we can, in a very knowledgeable and controlled way, deal with that. So that's part of the positive outcomes of having a shelter-in-place program.
Thank you. There's a couple questions here about really what happens during the end of the program. Meg, you had twice mentioned about people being asked to leave the program, so there's concerns. Is that going to be pushing people into the Soquel neighborhoods? You've talked about this a little bit, but maybe you could elaborate on how we're going to help these young people move from homelessness away from being perpetual clients of the welfare state. And I think there was one more. Why don't you start with those? And if there's one more about that, I'll ask you at the end.
Sounds good. So a part of my regular job is also overseeing a housing program. We actually have 5 housing programs that I help to oversee for young people. And in those housing programs specifically, we do case management, intensive case management, weekly meetings. We set goals. We look at, where does that young person want to be? Where are their hopes, their dreams? Where do they see themselves in 5 years, in 2 years, in 3 years? And really focus in on what are the tangible steps to get to where they envision themselves being. So with that meeting, those case management meetings, and just checking in, we do budgeting, we do helping them with resumes, with tenant resumes, supporting them in going to check out new places, to figure out what their income source will look like, whatever it might be, and then connecting them also to programs. And so we see a high success rate in folks getting into housing, staying housed, and then continuing on to figure out their next steps on their own, continuing to be housed, a lot of them, most of them. And so if somebody were to leave, we would just really support them in getting connected to the next thing. We recognize that not every situation is the right situation for anybody, and we want to support them in finding what their best option is to get housed and stay permanently housed, to be a productive adult and to figure out adulting. It's not easy, and most of us need a little extra runway, and so we're really providing that for them, and they know that we're there to really support them in whatever that next step looks like. And having that approach and that really autonomy built in, and that self-governance of this is where I want to be, I think is what really helps young folks to decide this is where I want to be in life, and to head off in that direction. And we can't be happier when they figure out find their next place and a permanent spot.
And just for clarity's sake, you've talked about family members, and we've talked about 30 people. Is there going to be more than 30 people in these trailers, or?
No, there won't be any more than 30 people. 30 people is our very max. We couldn't fit more than 30 people really into these trailers comfortably in a way that would make sense. I don't think, and so our contract says 30, and right now I think, you know, we're planning more between 24 and 27 with the actual folks that we're planning on putting into those spots. Not that it won't fluctuate a little bit, but it might be even a little less than 30.
And if people get pushed out of the program or asked to leave, where will they go?
Yeah, so we would support them in getting referrals to other shelters if that was something that they were interested in, or to other programs that are supporting the efforts to keep the spread of COVID low. If they were to leave on their own, some folks have their vehicles and were before shelter in place living in their vehicles. And so that might be the case, but most of the time there's really like set places where they go and they know that they're safe. We would refer them to the congregant or to some of the other programs that help support those efforts for keeping people safe that way too.
Thank you. So the question to me is asked, who's responsible if something bad happens here? On the question of the question is really related to catastrophic loss of life and property. I think we have put all the measures in place to make sure that that does not happen. If something happens where this site and this program is the cause of wildfire, the county will be held responsible, and people will come after us for remuneration. If something happens somewhere else that crosses the property, I'm not sure that would be the case. That's for the lawyers to decide. But we're not shirking our responsibility. We have taken great care to make sure both police and fire that we've created a program that will be safe from wildfire and not impact the neighboring properties or community. Sheriff Hart, there's a question about how many deputies are patrolling the beaches, and is that number part of your response teams to meet local needs?
Yeah, I think I answered that a little bit earlier, but I'll repeat it very quickly. We have our patrol teams and we have our beach teams. So the numbers that I quoted earlier of somewhere between 14 to 16 out on the patrol group. In addition to that, we have another 7 out on the beaches every day. And so the short answer is no, that the group that would respond up to Seventh Day Adventist is our patrol group, and there's 14 to 16 of them at any given on any time of the day.
Thank you. The question has been asked about how often the Community Advisory Group will meet, and I can't tell you a number. We haven't figured out a regular schedule. I've asked the group to meet fairly regularly before people move in so we can address the concerns. People have had a chance to hear these concerns here this evening. Anything that we don't get to this evening, we're down to a couple more questions. I'm sure people will still write them in. I think we're going to end around 7:30. If there's any other questions up there that we haven't gotten to, we'll be able to save them and talk about them among the community group. There's a question for Elissa. If someone at the homeless shelter at Seventh Day Adventist is showing symptoms of COVID, what's the specific plan to test, transport, and shelter that person anywhere?
Sure. So we do have guidance that we're working within our sort of COVID response system now for those instances. And as we mentioned, we would First, we would make sure they got access to appropriate testing. We have a system in place where we have a designated driver and vehicle that's part of our overall response. It's not specific to the TAY program, that would support safe transportation for that individual, and always using the appropriate PPE or non-medical grade facial coverings. And then we would also be doing testing of the folks who were like in that pod, in that group. If someone had a fever and started having the COVID cough, everyone in that group would be tested to see, because obviously they would have been spending some amount of time together. And then we would utilize our transportation protocols and equipment to move them to, as I mentioned, our isolation quarantine shelters that we have in place, which are hotel-based. And this is part of, I think some people have heard, the statewide, well, it's broader than the state, Project Room Key, where it's a specific FEMA-related reimbursement program for folks who are COVID positive or COVID exposed or highly vulnerable. We've also been able to put homeless people who are 65 years and older into that program. And we hold beds in that for instances where we have people who are homeless who have been determined to be COVID positive, and we move them into that space. So that's how we would do it. And then, we would go through appropriate cleaning at that trailer, and we would move from there.
Thanks. We have a couple more questions here. People ask me, why do this? Is this what I want my legacy to be, is the question. And there are people concerned. There are some people who don't even want this. Why am I doing this? And I'll just end tonight by saying that I take the job as supervisor very seriously. And in the last couple of weeks, I've never been asked to make as many life and death decisions for people's actual lives or their livelihoods as I have in all my time in public service. And I expect in the next couple of weeks, those questions will still come up. When we look at our response to the COVID crisis, we try to work on using science and data, using the best strategies possible to keep as many people as possible safe from this virus, illness, and possible death. We don't know how many lives we have saved by our early action. We don't know how well we have done in preventing the spread of the virus by people showing real leadership and sheltering in place when we've asked them to. Part of our response to this crisis is preventing the spread of this virus in vulnerable communities, of which the homeless is one. And we've worked very hard to find a number of sites where people could live that would place them out of harm's way, and therefore the community out of harm's way. These are difficult decisions. The issue of homelessness is a bigger issue of which the county is dealing with, which is a little bit big to take on for tonight's conversation. But I had Elissa Benson on my telephone town hall a couple weeks ago to talk about the overall strategy, and I'm happy to have her come back. But at the end of the day, the decisions we make have to be using that science and data, and also ensuring that we are protecting people's lives. And this is a temporary program to hit a specific targeted group that's at risk. And by working together for whatever period of time this shelter-in-place order, we are helping protect not only these up to 30 people who will be staying here, but the community as a whole. We'll be looking at all the questions that you offered here this evening. We'll be able to share them with the Community Advisory Group. And if we didn't get to them tonight, or you didn't feel like it was answered well enough, that will be something that the Community Advisory Group can go over and make sure they get the answers to the satisfaction that they would like. I'm not sure that someone who doesn't like this program will ever reach the satisfaction, but I'm committed to continuing to answer the program, to engage the community through this Community Advisory Group, and also use these forums to answer questions. I want to thank the leadership that we have in this community advisory group for stepping up, for committing the time it takes to ask the questions and get answers, to represent the community, and in a way to bring the community to the table. I want to thank Sheriff Hart and Chief Hall for their help with this. And I want to thank the members of Encompass and our county staff who've worked very hard to create a program that meets the pressing health need that we have right now, as well as taking into consideration the impacts on the community and both in Soquel and the county as a whole. I'll be on here next week with a university professor. He's got an unusual name, Marm Kilpatrick, who studies infectious diseases and is a professor in the Department of Ecology and Evolutionary Biology at UC Santa Cruz. He's a science advisor to the Santa Cruz County Economic Recovery Council that's helping us learn how to reopen safely. He'll be speaking about a wide range of COVID topics, including what we can expect as we reopen and ways we as individual and as a community can adjust to life with COVID. They'll be able to answer questions, and I look forward to that conversation. We have a lot of laps to go on this battle with COVID. Thank you for being here tonight, and thank you to all the participants. Good evening.